Living positively, living positive, living positively, living positive.
Molweni namkelekile kusenqoba beat it inkqubo yakhe wonke ubani ophila nentsholongwane kagawulayo. Iintsapho zethu, izihlobo kunye nabalingane bethu. Igama lam ndingunokubonga Yawa yaye ndiphila nentsholongwane kagawulayo. Iinkonzo zempilo zikawonke-wonke kweli ziphantsi kweemeko ezinzima kakhulu. Amanani amva nje akhutshiweyo abonisa ukuba kumaphondo alithoba, 5 abonisa ukuba kungapha kwe-36,000 yezithuba zabongikazi ezingenabantu. Kwaye kungapha kwe-4,500 yezithuba zogqirha ezingekagcwaliswa. Sonke siyazazi iingxaki zezibhedlele zethu neekliniki. Iingxaki zokulinda ithuba elide ungekancedwa, amayeza angonelanga, oogqirha abambalwa nabongikazi. Yonke loo nto yenze ukuba kunyaka ophelileyo amawaka-waka oogqirha abhenele kuqhankqalazo lukazwelonke. Usenqoba uncokole nabanye oogqirha ngezizathu zokuba baqhankqalaze.
Amalungelo wethu, amalungelo. Emva ukuthi odokotela bala kwaZulu Natal bangenela isiteleka, ngahamba ngokukhuluma nodokotela ababili ukuze sithole kahle imbangela yaso isiteleka sodokotela.
Of late, doctors have been on strike, and in KZN there were more than about 200-300 doctors that were on strike. What led to the strike?
For a number of years, doctors have been complaining about problems relating to infrastructure in the public health service, working conditions, and more recently, remuneration. There's been a steady decline in terms of staffing in the public health service for a number of years. The conditions are simply not good enough to attract people from outside the sector, from private and overseas in, as well as to retain the staff that we already have. In 2007, public workers across the board went on strike, complaining about working conditions and salaries. The government commitment in response to this was to implement an occupational specific dispensation which would seek to redress all of the problems relating to public sector employees. We as doctors were due to have our issues addressed in July 2008. This was delayed for a year, and only in April 2009 were our issues addressed in the bargaining chamber. In the meanwhile, independent research was commissioned by our association, which proves that doctors are underpaid by 50 to 75% compared to their colleagues in other professions in the public sector. The offer that was made by government ranged from between 0.28 to 5%, which greatly upset the doctors who had been waiting tolerantly for all of this.
So doctors went on strike?
Absolutely.
At the time of the strike last year, the Minister of Health, Dr. Aaron Motsoaledi, issued a statement in which he acknowledged that financial and human resource problems existed within the Department of Health. But he said, to suggest that the public health service is collapsing or in crisis is alarmist at this stage.
Kwaphuma emaphepheni ukuthi ke ukhona odokotela abaxoshwa. Njengamanje kwenzekalani ngalabo dokotela laba abasebexoshiwe esibhedlela?
Uhulumeni wathatha isinyathelo sokuthi axosha odokotela kodwa waxosha ayibonke waxosha about 270 ngokunqamula kwethu isiteleka uhulumeni wenza into enhle wababuyisela bonke odokotela.
Dr. Sham, are you not concerned that the public as well as the patients' sentiments towards the doctors might diminish because of the strike?
Right from the beginning of our mass action, we have always maintained that our primary concern is to improve the public health service for the eventual benefit of patients.
Baze baqonda abantu ukuthi njengoba size siye emgwaqeni akusilweli thina sodwa silelwa bona futhi ingakho sibonga ukuthi abantu basupportile. Ngiyajabula ukuthi abantu emakhaya abadinwanga isenzo sethu kodwa kunoloko bayiqonda ikhalo zethu ngoba bayazazi.
Later, Dr. Motsoaledi said, I wish to reiterate the statement I made publicly that the medical profession is underpaid and that is not up for debate because we know and accept it. I also wish to reiterate that health is one of our most important priorities, and we'll do everything to make sure that our medical doctors and other health professionals are happy and remain in the system.
Dr. Sham, is there anything that you want to let the people of South Africa know, especially any patients that might be affected by the strikes?
This is not an attempt to enrich doctors. It is an attempt to show the public the extent to which the healthcare system in South Africa is decaying and on the verge of collapse. It is an attempt to redress the imbalances, to attract more people into the service, and ultimately provide a better service for the people of South Africa.
Dr. Trevor, sibonile ogqirha bestrike sava ukunqongophala kwepilisi, ukunqongophala kogqirha kunye namanesi. Wena ezakho izimvo zithini kakolo cala?
Nokubonga kubhlungu kakhulu ukubona izimeko ezifana nalezo zenzakala. Kodwa ke we cannot deny ukuthi i-public sector yethu ye-health inama challenges amakhulu kakhulu, ranging from different resources, from human resource to products emele supply from within certain infrastructure facilities. Manje ke mina ngithi lama differences bewakhona awuhlala khona empilweni ama differences, kodwa as a healthcare worker you can imagine what happens if at all you don't pitch up to work and people expect ukuthi ube khona, especially labo ukuthi basuke badinga lokho esithi emergency care. So if kunama differences between ama healthcare workers thina and government, then kubalekile ukuthi sihlale phansi senze ivumelwano, and kubalekile futhi ukuthi no government I respect ama agreements akawenzayo. But most importantly, if kukhulunywa kwenziwa ama win-win solutions, inkinga ezifana lezi zinga-addresseka. Sesicalile ukubona ukuthi there is progress eseyenziwa in certain areas, but there's still a lot that needs to be done. Akuzomele sibambisane. Siya-encourage futhi ukuthi ozakwethu bangahambi kule country, bahlale silungise sonke. Ngoba lento ukuthi abantu bahambe basebenza kwabanye amazwe bashiye lelizwe lethu leli, but le nkinga zala ziyolungiswa ngobani?
Ogqirha baye babuya umva bamkela ukunyuselwa imali engaphansi kwe-50% ebebeyicelile. Icandelo logqirha i-South African Medical Association lithi ogqirha abasebenza kwicandelo lenkonzo zoluntu babhatalwa ngaphansi kakhulu kunabanye abasebenzi abalingana nabo kurhulumente. Bahambise bathi baza kulwa de kufikelele ekubeni ogqirha babhatalwe imali ebafaneleyo.
To date, the dispute between public sector doctors and the Department of Health continues. Doctors belonging to the South African Medical Association, SAMA, have threatened to resume strike action from April 1st this year if the government does not resolve the ongoing problems related to the implementation of salary increases for doctors. Fidel Khadebe, spokesperson for the Department of Health, says it's shocking and irresponsible of the association to make public threats of this nature at a time when the health department has just started the process of building the capacity of the public health sector to perform and deliver in our country.